So speaking of how COVID-19 may have impacted the school-age children, and I'm seeing this now as the children are coming back to school, you see that when they went into lockdown, they have no structure, no routines. Those kids with ADHD who had academic support or extra, one-on-one teachers lost that completely. They have to have their parents supporting them, and sometimes their parents were stressed out. And then, you have a death in the family, or maybe one of the parents is sick from the illness. They lose their job, and they have more social isolation, so they don't see their grandparents anymore. The extended family. Reduced social and sport structure that is very good, like exercising and sport team activities are very good for kids in the school. Problems with sleep, as I mentioned, because they don't have a schedule anymore, so they stay up all night. Initially, they thought it was a long vacation. And then also the reduced expectations. So sometimes the kid is not having a lot of problems from the academic point of view, but you don't know whether that's because they reduced the expectation and they're just, passing everybody, or because they're getting better. So you kind of in a struggle. You don't have a point of reference as you had before when they were going to school, having their academic support and so on. We did with the UNICEF's European Network for ADHD Guidelines Group. We did these guidelines for initially in the pandemic, and we've updated those for the treatment using telemedicine, because using telemedicine is also a struggle. You don't see the patient in the office; you see the patient through the screen, and sometimes they might be very fidgety, so you don't see that. And you start to lose some of the information. And I see now that when they're coming back to the clinic in a few seconds, you can assess how they're doing just by looking at them. All right. From the point of view of depression, you have to. I wanted to remind everybody that suicide is the second cause of death, starting at age 10 till age 34, and the first cause of suicide is depression. We're part of the Texas Child Mental Health Care Consortium, which all these hospitals, and we're studying depression in youth and suicidal behaviors. From the point of view of anxiety in different studies is very prevalent. This is a study in Norway only with anxiety symptoms, not the diagnosis, and 33% of the patients, these were preschoolers, had anxiety symptoms. Of those who had ADHD, a third had anxiety symptoms. And then you also have to remember that anxiety or different anxiety disorders have a different age of onset. So you start with simple phobia, separation, and then maybe social phobia, generalized anxiety, and so on. And they come one after another in their development. So there might be different layers of anxiety symptoms.